Dr. Adalyn Almora, the skin and beauty doctor here at Ada Viva Clinic. A lot of my patients are asking me, and they are very worried. Is their mole dangerous? Is it cancerous? This is what I tell my patients. Look at your mole. Check if there are telltale signs if it is malignant or benign. Check for the A, B, C, D, E sign. A, is it asymmetric? If you divide your mole in the middle, check for the right and the left side. Do they look like mirror image of each other? B, border irregularity. Are the borders fuzzy or irregular? Or is it sharply demarcated border? C, is the color uniform or more than two colors or two colors? Or it is just brown or a different shade of brown? D, is the diameter more than 6 millimeters? E, is the mole evolving in size, shape, and color? Let me know if the answer is yes. Is the mole asymmetric? Are the borders irregular? Is the diameter more than 6 millimeters? Is the color more than one? Or is the mole looking a little different when you observe it from months and days at a time? Is it evolving from shape, color, or size? If the answer is yes, then probably your mole is a malignant mole. It could be dangerous or cancerous. The A, B, C, D, E telltale signs to check for a mole is very good, but it is not the most accurate. So if you are still worried and you want to use a more accurate way of checking for your moles, then you should use dermoscopy or biopsy. Dermoscopy is a new procedure. It is used by a lot of dermatologists around the world. This is actually a skin microscopy procedure that is mainly checking for pigmented lesions. So, for today, I want to show you our procedure here at Ada Viva Clinic. I am going to show you how we are going to apply A, B, C, D, and E signs to check for a mole. And then afterwards, we're going to use a dermoscopy to check the accuracy of our clinical findings. So we have here our patient, a 27-year-old male who has had a mole in his back ever since he was very young. It has been growing slowly, but it has stopped growing when he turned 25 years old. So come here guys and take a look. So as you can see here, the mole is fairly symmetrical from its left and right side. If we divide it in the middle, it looks like a mirror image. The borders are fairly sharp and regular. The color is almost one color of two shades, dark brown and light brown in the edges. The diameter is around, let's check that guys, 4 millimeters. And the evolution, it is very good because it stopped growing when he was 25 years old. So this is a typical of a body mole which is benign. To show you how it looks in a dermoscopy. There you go. Come closer guys. Okay, close my... So, come closer and look at our dermoscopy results. So, this is a very nice, accurate way of checking if the benignness of the mole is true. We can see here that the symmetry of the mole is very good. The shape, the color, and the structure. The color is arguably two shades, but no colors other than brown. The pattern has an amorphous center, peripheral globules, two patterns which exhibit excellent symmetry in two planes. The edge is regular, string of globules all the way around. There is nothing wrong with this mole. This is a benign mole, which is seen in our dermoscopy findings. So that's how we know how our mole is benign or malignant, using the A, B, C, D, E signs and our dermoscopy procedure. So right now, we have here a 35-year-old male Caucasian who has multiple moles in his back. So this is how I use my dermoscopy. So what is good with our dermoscopy procedure is that even though the mole is less than 6 mm, we can actually check if there are signs that the mole is presenting with a typical or malignant behavior. So if you want to have your mole